Alan, I do want to get your thoughts on the brighter future of tomorrow and what's going to happen. But listening to Dacher talk and bringing up again all the work you guys have done, and I'm wondering, when it comes to the different ways in which emotions are processed and exhibited by those with autism, is that data sort of siloed into its own space for now, or is there a great value of including that in this sort of baseline of human emotion? And I'm just I'd love to hear your perspective on that and what you think.
I think it should be included. I think that, if autism is a spectrum, then I think many other disorders are spectrums as well, from healthy functioning to different kinds of, eccentricities or sort of dimensions. And so much of that hasn't been explored. And I do think the data, when you say has it been segregated, I think the way it's been studied has been very largely segregated. Right. There's developmental psychology, there's emotion science. In emotion science, you don't study these patient populations, you don't typically study kids, and then there's intersections. But typically, if you're going to do a study, it's one or the other. It's either a study of healthy functioning and variation, or it's a study of one population and not of the overall neural diversity, which actually probably would require a lot more data, right? So I think one of the really exciting directions for the future is to study neurodiversity in more of a data-driven way, not focus on sort of diagnostic categories being your prior, but focusing on symptom dimensions being extracted from data, and understanding which dimensions are actually things you care about, which dimensions are causing people negative emotions, stress, tantrums, all of those things. And working backwards from there to solve those issues. And then you have, what are the critical moments that reveal those dimensions in life? And how can we gather data at that critical time? So we lower the lift on finding the right, because essentially what the doctor is doing when they're diagnosing a patient is a form of data processing. That's pretty much it. I mean, if you can lower and that session is very expensive. It's a very expensive form of data processing. And so the fundamental problem is to make the data processing cheaper, right? Because like what Dennis' work is heading toward, I think we need that in every dimension of clinical care. So I think that it's really important to find what is the sort of lightest weight intervention to gather data, at what is the right time to do it, and how do you process that data. I think a lot of that could potentially be working backwards from where do we experience the most negative emotions. It can be alerted to sort of document that and then find the root cause.